If the patients show either your medical director, your lab manager, or the on-call doctor to mention about this patient with really high blood pressure. But the third thing you have to do is you have to check it manually. If it stays high on the one arm, you move to the other arm, still very high, then you have to get your manual sphygmomanometer and check, okay? Then if it's still high, you have to call the doctor and clear whether the doctor will tell you to resume the sleep study or send the patients home, or when the blood pressure is really high and the patient has a history of myocardial infarction, stroke, or anything that leads to that. If the patient is taking medications for any cardiac problems, then you need to also send the patient to the ER or urgent care. Okay. Now, sometimes the patient will have severe COPD. Maybe when we look at the chart, when we come into the sleep lab, first thing that you need to do that we discussed in chapter 1 is that you check the patient's chart so you know the type of patients that are coming in. If you look at the, say, Mr. Jones, you look, oh, Mr. Jones coming in for a bi-level titration. You look, oh, patient has severe COPD. Wait a minute, the patient was just in the ICU 3 weeks ago, okay? So you have to be watchful of these types of patients and be prepared. My patient was just in a hospital about 3 weeks ago. I'll make sure I have my oxygen ready and my AED ready, okay, in case this patient ends up with any type of respiratory distress. But typically, when you titrate a COPD patient, when you are in an appropriate bi-level pressure, then you actually help them that night. It's an amazing experience when you see this severe desaturations. And I've seen COPD patients of mine with oximetry down to the 40s, sometimes 39% oxygen saturation. It's mind-blowing because, wow, how can you live like that? But then I put them on a CPAP. Of course, they don't do too well on CPAP if they already have severe COPD. Typically, if COPD is just at the beginning stage, they can still get better with CPAP. But eventually, they will have air trapping or CO2 retention. So what needs to happen is really they need to be titrated with a bi-level machine, the bi-level mode. And eventually, when they get worse, they will need to have a bi-level ST or with a backup rate.